Welcome to South Dakota HOSA's The Pulse. Today we sit down with Dr. Okine, a psychiatric physician's assistant in Sioux City, Iowa.
So my name is Albert Okine, and I work at Dean and Associates, which is a private psychiatric office here in Sioux City. I grew up in Accra, Ghana, and this is in West Africa. Decided my career path, when I was quite a bit younger, probably even around middle school. My dad had a mechanic workshop in our home, and some of his clients were doctors who would come to the home over the weekend with their vehicles. And I remember quite well as a young child, talking to them and asking them what they do. And I was quite fascinated with them telling me that, they provide cure for people with different illnesses. And that really, for me, was very noble. And then what really affirmed that is at the end of my high school year, a very close friend of mine had nasal cancer, and he finally died of that. But during that period of time when he was going through treatment, I would visit him and I would see how the doctors work, and I was very, very impressed with him. I work as a psychiatric physician assistant. And what I do mostly is meet with patients from ages somewhere between about 5 years old to probably, geriatrics, very old people. And I would spend time with them, do an assessment, come up with a diagnosis depending on what sort of behavioral or mental health issues that they have, and then come up with a treatment plan. And I would either provide medication interventions or sometimes provide recommendations for psychotherapeutic interventions or other things that could be used to help them. So the best part of my job is to see when individuals that I treat respond to treatment. In psychiatry, I believe when we offer a treatment to a patient, we don't only impact an individual, but we impact a whole family. And sometimes that extends to friends, to teachers at school. And it's neat to see. We have a lot of clients that oftentimes we get to the point of despair at a brink in time where they just feel helpless, and to see them turn around, really, it's very rewarding. Yes, I definitely doubted myself along the way. I would expect that every normal person would have that. I remember when I first, I'd always thought about wanting to go into medicine. That was my dream. Back home in Ghana, I did not, get the grades that was needed to be able to get into medical school when I first tried. And so I came here to the United States, and I know there was much more options here because there's only 2 schools back in Ghana at the time when I tried to go to medical school. And so the path was very narrow. But then I came to the States, and I remember, having some struggles with organic chemistry. So right away I knew that was probably, may not work. But then, I persevered and kept with it. And then when I finished college and applied to medical schools, I did not get accepted to medical school. And so I ended up just going off course. I worked as a pain chemist for 10 years. And then in 2004, at the time I had 4 kids and a wife, I opted to go to physician assistant school. So managing work-life balance is fairly difficult. It's, I've learned to pretty much weave my work into my family life, and fortunately my family and my kids have somewhat accepted that, I think, to a point where they seem to enjoy my successes at work, and that spurs them on and makes them even feel better. And so that has given me some slack. And then, I remember at the beginning of my training, I had, huge support from a church family. My wife was at home full time with the kids. I was hugely supportive. And then when I'm not doing any work, I would always make sure that I'm very present for family things, for kids. We had family vacations that we had to intentionally organize. We had church family activities that we did intentionally. And so you try and create a lot of opportunities where you could be involved in family life. I attended every parent-teacher conference, even during times when I was in school, because I knew that was just an important thing. And so it's not easy, but you do the best you can. So if you're thinking of becoming a physician assistant, which is a profession that allows you to be able to go to a lot of different specialties, then I would definitely encourage you to shadow a physician assistant and kind of get a sense of what they do. And sometimes even looking at different specialties within that field, if at all possible. But then if you want to go into psychiatry, just like what I did, one of the things that I would definitely encourage is probably doing some volunteer work at places like homeless shelters, places where they provide services for people with disability and things like that. And I think sometimes those could really convince you, if that's something that you feel comfortable with. Being in the field of psychiatry requires someone who has a different kind of compassion, because it could be very, very challenging, and sometimes if you're not careful, you could go home just spending hours just worrying about what you engage in during the day. So I would encourage you to just shadow a psychiatric physician assistant, doing as much clinic observations if you can. The other thing I would talk about is possibly doing things like EMT work, even taking CNA courses, working in a nursing home where you see a lot of patients that have dementia and things like that. And all those things will prepare you for a field in medicine.